Why is fuel in St. Lucia $16.50 a gallon? Antigua pays $14.50, Dominica $13.90, St. Kitts just $12.76. Yet for 4 years, St. Lucians have paid the highest fuel prices in the OECS. And it's not just at the pump. Electricity is up, bus fares are up, the cost of goods through the roof. Why? Because Prime Minister Philip J. Pierre removed the $13.95 fuel cap put in place by the former United Workers' Party and never looked back. While other islands shield their people, this greedy SLP government lets you carry the weight. This isn't leadership, it's neglect. It's time for relief. Time for real leadership. Time to truly put the people first. United Workers' Party, standing with you, fighting for you. Pierre Parbon.
Did you know that under the UWP, a total of 871 citizenships were sold between 2016 and 2021? So far, the SLP has sold 14,000 citizenships in 3 years.
Did you know that the price of fuel was capped at $13.95 per gallon under the UWP? But that cap was removed when Philip J. Pierre became Prime Minister. The price per gallon is now $16.50, the highest in the OECS for the last 3 years.
Did you know that homicides have increased by 25% since Philip J. Pierre became Prime Minister? Over 280 homicides have been recorded in the last 3 years. Did you know that the price of kerosene increased from $7 a gallon under the UWP to $11.69 per gallon under the SLP? A whopping $4.69 more per gallon.
Did you know that Prime Minister Philip J. Pierre cancelled the National Health Insurance Program, which was started by the UWP, and would have given every St. Lucian $75,000 worth of healthcare coverage every year?
Hard-hitting, punchy, straight to the point, like it is. Starting on Monday, September 23rd, 2024. And every Monday from 8 p.m. Join in our simulcast on Hot 7 TV, Cable 117, Plug and Play, Channel 7, and Kiss FM 105.5 and 105.9, where we discuss politics and current affairs, the issues that matter and concern you, with your host, Spider Montoot. See you every Monday from 8 p.m. when we tell it like it is.
Dear Prime Minister Pierre, did you know that over 240 St. Lucians have been murdered under your watch?
I'm not a policeman. My father was, not me.
Are you aware that the last 3 years have all seen record-breaking homicides?
I'm not a policeman. My father was, not me.
Murders have increased by 25% under your watch. What is your plan?
I'm not a policeman. My father was, not me.
Why are you not giving the DPP the resources he requires?
I'm not a policeman. My father was, not me.
Why are you allowing Ernest Ile and Richard Frederick to get away with all this corruption?
I'm not a policeman. My father was, not me.
Why do you keep rejecting advice on crime solutions from the UWP?
I'm not a policeman. My father was, not me.
Why have you abandoned the Border Control Initiative?
I'm not a policeman. My father was, not me.
Why did you initially abandon the K9 unit?
I repeat again, I'm not a policeman. My father was, not me.
So come Friday, right around the Printry from by Parliament, coming across onto Jeremy Street, that area will be deemed a no vending zone.
Good morning and welcome to this week's United Workers' Party press briefing. And we want to welcome all of you who are joining us via live stream. Those of you in St. Lucia, around the Caribbean and in the diaspora, welcome once again. As today we have two presenters. We have for you the endorsed candidate for the United Workers' Party for the constituency of Dennery South, Mr. Benson Emil, and we have with us the deputy political leader of the United Workers' Party, an endorsed candidate for Castries South East, Mr. Guy Joseph. Today we are going to look at, among the many crises that we have in this country, one of our major problems, that is the issue of healthcare here in St. Lucia. As you know, we have heard from the people directly involved in the business of providing health services in St. Lucia, the doctors and nurses. We have heard from the St. Lucia Medical and Dental Association that at this point in time, under the St. Lucia Labour Party government, this is the worst that the healthcare system has ever been in the history of our country. Ladies and gentlemen, if this is not a crisis, I do not know what is. This is a matter that must be addressed, and of course, there is hope, because the United Workers' Party, with its formidable team of men and women under the able leadership of Alan Michael Chastney, they have plans to remedy the problem and to rectify this atrocious health situation, which contributes, among other things, like crime, in taking the lives of St. Lucian. So to begin our presentations this morning, I would like to call on Mr. Benson Emil, as I said, the endorsed candidate for Dennery South, who is a former permanent secretary in the Ministry of Health, who will speak on the topic.
Thank you, Spider Montut. And let me say, pleasant good day, pleasant good morning to all St. Lucians, those living in St. Lucia, and those viewing and participating in the diaspora. My presentation this morning will focus on providing clarification on national health insurance and the UWP's proposal when they're in office to implement national health insurance. The United Workers' Party is reaffirming its commitment to improving healthcare access for every St. Lucian through the introduction of national health insurance, a system that is practical, sustainable, and a people-centered approach to healthcare reform that ensures every St. Lucian has access to quality and affordable healthcare. The proposed national health insurance system is designed to ensure that every St. Lucian has affordable access to quality healthcare when they need it and not when they can afford it. Under national health insurance, the working population assessed to have financial capacity will cover themselves with health insurance, and employers will be incentivized to cover their employees as well. The government will commit to covering the costs of the premium on behalf of vulnerable groups, such as the elderly, the unemployed, and families assessed to be poor. In addition, the government will pay the salaries of all staff employed at the state-owned health institutions and meet all capital cost outlays. This model creates a shared responsibility system. Everyone contributes according to their means, and everyone benefits equally when they fall ill. In simple terms, national health insurance protects families from the financial shocks of illness. It removes the burden of out-of-pocket payment at hospitals and clinics, while ensuring that health providers, including state-owned operators, are properly funded through the payments of claims issued for the health interventions they provide. Our state-owned health providers will be financially empowered to cover the operating costs in a timely and effective way. Our party believes that health is not a privilege, it's a right. Our National Health Insurance Plan guarantees that no family will ever again choose between paying medical bills or putting food on the table. This is how we make healthcare truly accessible for all St. Lucians, not just in words, but in actions. The United Workers' Party's national health insurance will be financed through employee and employer contributions, structured to be affordable and fair. Government subsidies ensuring that low-income families and the most vulnerable in our society are fully protected. And strategic partnerships with the private sector and international health agencies to strengthen the sustainability of the system. This broadens the financing burden of healthcare, thus ensuring that no one is left behind and that funding is not a hindrance to care. The benefits to our people: access for all. Every citizen, regardless of income, will have access to essential healthcare services. Financial protection. Families will no longer have to face catastrophic medical bills. Improved quality of care. Hospitals and clinics will receive steady funding, ensuring better service delivery and reduced waiting times. Health system strengthening. Sustainable financing allows for investments in equipment, training, technology, etc. Economic sustainability. Healthier citizens mean a more productive workforce and a stronger economy. While both systems, that is universal health care and national health insurance, aim to expand access, universal health care and national insurance differ in how they're structured and financed. Universal health care is a government-funded model that the state directly pays for all or most health services for the population through tax revenue. In a small economy like St. Lucia, UHC can place enormous burden on public finances, especially when revenue is limited. We have seen the challenges because for four and a half years later, the Labour Party has only been able to provide care for 361 pregnant mothers, 4 people with snake bites, 1,140 men for cancer screening, and 4,780 cervical cancer screenings. While the majority of our population of 180,000 continue to languish, defer their care because they cannot afford, and die due to lack of medication, lack of beds, limited access to modern equipment, and mass resignations of doctors and nurses. Implementing UHC successfully requires increases in government spending, which can be difficult to sustain in the short, medium, or long term. By contrast, the UWP's National Health Insurance spreads the financial responsibility across society, individuals, employers, and the state making it a more practical, sustainable, and more immediately achievable. NHI creates a partnership between citizens and government, ensuring that healthcare access expands without overburdening national budgets or increasing tax drastically. During the tenure of the last UWP administration, extensive work was done towards implementing national health insurance. The government of St. Lucia in 2018 received a US $25 million loan from the World Bank towards the design and implementation of a suite of programs geared towards strengthening the health system in St. Lucia. In recognition of the need to lower out-of-pocket expenditure and broadening access to healthcare, the Cabinet of Ministers, by Conclusion 332 and 763 of 2019, mandated the construction of a National Health Financing Committee. This committee provided policy recommendations related to the introduction of a financial modality that facilitates broader access to healthcare, spur greater take-up on preventative care interventions, and lower the incidence and prevalence of several communicable and non-communicable diseases. The committee recognized that despite the hefty amounts invested in the health sector for primary care and secondary interventions, government's financing for the health service government's financing for the health services still was greatly inadequate. And there needed to be a cash injection in the health sector outside of what government can provide. Given this assessment, the National Health Financing Committee recommended that a standardized health insurance policy be instituted in St. Lucia as a minimum. Before the UWP left office in 2001, the Ministry of Health accomplished the following with respect to NHI. One, defined the health interventions to be covered by the standardized health insurance policy. Two, appointed an insurance agent. Three, submitted requests for proposals and received from insurance companies and received responses from insurance companies to cover the essential health services proposed. Four, conceptualize the NHI mandate, where the premium for the poor and vulnerable and unemployed would be paid by the government. Held broad consultations for health providers, health provider groups, employer groups, insurance provider groups, etc. Engaged providers and develop terms of references for procuring support infrastructure for NHI, which included the management information system, a registration system that leveraged SLNet, which is the approved means assessment platform for the government of St. Lucia. After years of denial by the Labour Party that nothing was done with respect to NHI, I am pleased to hear that Minister of Health, Honorable Moses Jean-Baptiste, at a press briefing recently, finally acknowledged that some work was done by the previous government. He acknowledged that discussions were held with both insurance companies and the private sector agencies. The minister went as far as saying that the proposals submitted by the insurance companies averaged an annual premium of $2,000 or $166 EC monthly. I don't know about the figures he quoted, but it demonstrates that the UWP was telling the truth all along. Our plan for the implementation of national health insurance was always that St. Lucians who already have healthcare insurance will remain under the plan. That all employed deemed capable would pay the premium, and employers, as an incentive, would contribute on their behalf. This means that the St. Lucia government would contribute on behalf of its employees as well. The government of St. Lucia would pay the premium for the elderly, the poor, and the unemployed. This is a sustainable model. The United Workers' Party is very pleased that the Labour Party has finally seen the wisdom in implementing national health insurance, to the extent that Minister Moses Jean-Baptiste agreed that the implementation of universal health care is very challenging, and that his government also intends to implement national health insurance as part of its financing model. In conclusion, we emphasize that the United Workers' Party national health insurance is not just a policy. It is a promise of dignity, security, and fairness. It empowers citizens to seek care without fear of costs, and ensures equity in health access. We believe that financially able St. Lucians must invest in their care, and an insurance premium is not too much for a caring government to spend on citizens that cannot afford it. The UWP is ready to deliver a system that works for the people, with the people, and sustained by the people. I thank you.
Thank you very much, Mr. Benson Emile. And ladies and gentlemen, you just heard from Mr. Emile, who elaborated and gave some clarification on the implementation of national health insurance, one of the 7 SOS policy decisions of the United Workers' Party, which will be implemented upon returning to office after the next general elections. This, I must say, will provide hope for all St. Lucians and will bring an end to the days when a person becomes ill and we have to go through the indignity of seeking charity to care for our sick. I would now like to call on the Deputy Political Leader, Mr. Guy Joseph, who will speak as well on the subject of health, and will also, as usual, give us some summary of the topic being discussed in the Creole language. Like anything else, we are in October, Creole Heritage Month. I now present to you Mr. Guy Joseph.
Thank you very much, Mr. Montout. Et quand Monsieur Montout dit nous à moi créole, so moi vais commencer avec teasing créole pour dire bonjour pour tout le monde en Sainte-Lucie et en l'autre pays qui a suivre nous bon matin, qui a écouté nous. Nous savons que tous les mardis bon matin on va prendre un petit temps pour tant ça nous pour dire. So nous remercier tout le monde. Moi aussi quand prend chance ça pour moment ça pour souhaiter tout le monde à Sainte-Lucie une bonne journée fête créole pas quitter rien, toi casser l'idée ou diwan saison célébration ça, on célébrer dans bonne manière, on nous pas boire trop, on nous pas behave dans manière qui pas bon, on nous fait saison fête créole ça, yon dat nous pas ni pièce crime, nous pas aimer pli 3 cas à sous c'est moun nan qui ka travaille en santé, since nous ka parler about santé bon matin. So point précaution là ou ka drive à sous chemin pas boire ek drive à même l'air. Sous ça vous ka boire maintenant moun qui pas ka boire pour drive ou diwan fête créole. This morning we are here to further discuss the issue of healthcare. Because it is important, it is one of the most critical components of where we are as a country and what is happening. And it is the responsibility of government to address the issues of healthcare. Any country in the world that is going to be successful, productive, that you can create wealth and you can build a high quality of life, healthcare is of paramount importance. The quality of our health institutions are of great importance. Now, I parle about ça, Monsieur Benson parle about, because Iba nou achay bon information about Département santé ek plan qui déjà fait par di temps UWPT là mais avant because c'est dans ces bail là dit c'est ça I parle about là ni yon de les autres points moi voulais toucher avant. Premier, gouvernement poko sa ban nou un bon réponse à sous St. Jude Hospital. À sous l'hôpital St. Jude gouvernement ka bay de yon de signal mais yo pa ka di nou directement ki manière baye. Nou ka tan chay moun ka parler. Nou jatan monsieur Reno Gajada kon contractor parler plus about St. Jude passé premier ministre là ek se moun nan ka représenter janvier fort. Ek nou ka parler about Laboui, nous ka parle about Vieux-Fort North, Vieux-Fort South. Ça qui ka étonné moi de c'est ministre qui ni responsabilité pour santé ka représenter Vieux-Fort North. Et bien souvent il pas ka di Saint-Lucien en rien about ça qui ka fait en St. Jude. Qui manière St. Jude, juste pour ces jours ça il paraît après combien de temps et il dit yo ka garder si St. Jude ka ça ouvert plus tard finissement l'année nous ja octobre ja fini so pour Noël ou ka tirer moun ek mene yo entrer en St. Jude parce que nous ni pour comprendre les gouvernements pas honnête et pays nous pas ça ni confiance en information en gouvernement kabano. Le gouvernement les batte en opposition. Yo di nou yo te besoin penti et chimico pour te fini l'hôpital St. Jude. Mi ini 4 l'année et demi les ba en pouvoir yo ja dépensé en haut 250 millions de dollars. Et St. Jude still poko fini. Et yo poko sa di nou directement qui date yo ka ouvert St. Jude. Now mwen vle di se moun nan ki ni responsabilité pour différents affaires en pays. Et mwen ka parler bay Jean Planine expressement. ek sa nou kouye DCA Board, Development Control Authority. Ou ni a responsabilité, les moun ka bati kay, les moun ka bati building pour business, ou ka fait examination. Ek ou ka di si building na pa en ordre, ou pa ka bay approval. An investigation kay ni pou fait as pou eslani approval pour St. Jude kon l'hôpital. C'est premier pas. Deuxième pas, si il y a approval, qui moun qui bay approval, et est approval la joine toutes conditions pour bâtir l'hôpital. Là, moi, je voulais poser à un moment pour présenter un bail. Et moi, je demande tout Saint-Lucien. Allez à sous Google et regardez l'hôpital là qui a fait en Saint-Vincent à présent. OICC, même compagnie Taïwan, nous te ni qui te ka bâti l'hôpital St. Jude. Yo ni un contract et yo ka bill en l'hôpital neuf en Saint-Vincent. Moi pas vle moun just point sangadia, ay gade ou sa just Google OICC Hospital Construction in St. Vincent. Ou sav sa ou kaywe? En l'hôpital neuf kabati et puis l'hôpital là c'est between 100 et 110 millions de dollars. Moi vle quoi c'est l'argent mérité because là où read c'est bay ça c'est sujettement c'est so si c'est 100 000 dollars mérité c'est 270 millions de dollars en l'argent ici. But où savent ça moi réaliser? Il dit l'hôpital ça a ni 243 couches. 243 bed facility. $110 million. And the hospital would have the capacity to extend beyond that another 16 beds, taking it to 259 beds, with some very specialized services being offered. The same OICC that was fired by the St. Lucia Labour Party upon assuming office is also building a brand new hospital in St. Kitts. So if the Labour Party governments in St. Vincent and St. Kitts have so much confidence in OICC, why did the Labour Party in St. Lucia fire OICC on the projects that they were doing? These are legitimate questions that the people of St. Lucia need to ask. Because the new hospital that the United Workers' Party was building in St. Jude was being built by OICC to a great extent. The major works on that hospital was being done by OICC. Now, I want people to pay attention. They were also working on the airport. They were fired, but I'm not talking about the airport today. So, si Saint-Vincent, sa bill en l'hôpital, qui kay presque 260 couches, eh bien, en haut 250 couches pour 110 millions. Qui manière nous a dépensé en haut 150 millions de dollars? Mais oui, tiens. À dans un l'hôpital qui pas kay même ni en 100 couches. Et c'est pas l'hôpital neuf, c'est on l'hôpital qui te hala, yo ka ripe. Saint-Lucien, an ouverzier nous, ek an gade, pas quitter gouvernement kwen nou, whether flambeau, whether Labour, pas quitter pièce gouvernement kwen nou. Ouverzier ou ek gade, ek examine, qui ça c'est vraiment, c'est différent parti gouvernement qu'a présenté, ek examine information pour qu'on ek déterminer si bon, si un moun di ou, moi ka bati an kay 9 ba pour $200,000. Nous pas parler millions, nous pas parler an kay. Pour $200,000. La bati an kay 9 ba. Mais yo di ou vie kay la ou ni la ki jani en haut 80 l'année. Moi ça ou anje kay sa ba mais kay coûte $400,000. Mande kon question. Qui laisse ou kay souezi? Ou kay souezi pour anje vie kay la ek dépenser un extra $200,000 double pour ya? Eh ben ou kay di ngay bati an kay nef. Et qui kay coûte moins half pour ya. Sou pas bien comprendre ça radia. C'est différence là between Labour et Flambeau. Labour a dépensé $400 millions pour ranger un building qui pas même bâti pour l'hôpital. Qui jani en haut 80 l'année. Qui ni termite en dedans, qui ni mold en dedans, qui ni galvanise en lay, et qui yo oublié about un l'hôpital neuf qui bâti, et qui pate kay coûter half pour ça. C'est différence là between Flambeau et Labour. Flambeau te ka ba en l'hôpital neuf. Écoute ka ni de l'hôpital en yon. Downstairs ou te kay ni regular St. Jude la, ek upstairs ou te kay ni se area ka specialize en different treatment ou kay jwen. Ek mwen vle ou ale gade Saint-Vincent pour ouais dat se service la ki kay offert en l'hôpital neuf Saint-Vincent. Ou savent dia Ralph Gonzalez ka boss dat Saint-Lucien ni pour venir Saint-Vincent pour ay ouais docteur, pour ay l'hôpital. Ek gade laisse John ek partisan Flambeau te en gouvernement. Nous te japli devant passer tout ces pays ça. À présent yo tout ka passer nous parce que les bas parti ka chin développement Saint-Lucie there. Nou ma vle just di ou bay, mwen vle moutwe ou. So, la ni bay yo pon met nou. Ek mwen kay gade pou asou page 42 a manifesto Labour Party pou 2011. Mwen toujou eme moutwe ou li. Because ma dou sa li de mwen di mwen. Nga moutwe ou sa yo di, mi sa yo di. Proper accreditation. We will make it mandatory for all health services, public and private, to enter into formal accreditation process. Our goal is to have all of our health services accredited by a recognized international agency by 2016. En 2011, Labour Party promet à sou manifesto yo dat tout moun ki ka présenter service lay vini pour santé moun en Saint-Lucie yo kay ni pour trouver koyo sa nou accreditation mean I kay jwen approval pas just from planning department but an institution internationale qui ni responsabilité pour garder dat tout service qui ka offert en place pour ka ba ou service pour santé ka joindre tout standard qui établi international pour sa ben bon treatment pour santé. Moi vle mande Saint-Lucien en question. Yo di sa te kay fait en 2016. OK, an di yo pan tan fay en 2016. Yo perdi l'élection. Et yo di sa en 2011 yo ten 5 l'année pour fay. Yo pas fait. Yo vi un gouvernement en 2021. Mi jani lot 4 l'année di mi encore yo un gouvernement. Comme health institution en Saint-Lucie qui ja trouvé koy accredited. Et yo savent bien dans l'hôpital là yo ka dépensé 400 millions de dollars sur là. Pas ça trouvé koy accredited parce que il pas bâti pour service là yo vle offert là. Et nous kay ni temps pour examiner ça please. Moi vle ba ou pli information ça because ma vle ou just di nous ka just vin accuser gouvernement of bagay c'est ça tout political party ka fait non. An gade ça yo di encore because monsieur Moussa vini ek il dit la ni difficulté pour implémenter universal healthcare. Mais c'est ça yo ka promettre. Tant ça yo di encore en 2011. As page 48 of manifesto. Universal healthcare a reality. C'est title like tant ça dit. It is our party's mission to ensure that every St. Lucian has access to a package of guaranteed health services. And then it goes on to say, in this term of office, our party will implement universal health care. Encore, en 2011, Philippe J. Pierre, Kenny Anthony, Labour Party a promis tout that you can implement universal health care by 2016. Nous en 2025, Hodia Moussa ka vin di nou, i difficile pour implémenter. I jani 14 l'année. Now moi just join copy 2001 manifesto, moi te mande pou yon ek yon porte, amoun porte ima. Mon a chance pour aller fruit, mais ngay dou si yo te promet ça 2 millions tout because moi manifesto a brisa. Mais ga just mouto asu information mania. 14 l'année en gouvernement ka promet tout yo kay menen universal healthcare. Yo poko sa menen juste toujours. Now as page 42 because moi vle ou kopan nous parle about accreditation. As page 38 nous parle about sayodi that you can implement. As page 47 tan sayodi establish universal healthcare to provide a comprehensive publicly guaranteed package of health services to St. Lucians, developing accountable, efficient, well-managed public hospitals. Dis-moi combien l'hôpital qui a managé bien en Saint-Lucie, Hodia, en Labour Party. Combien l'année yo ka promettre nous ces bail ça? Et avant monsieur Philippe J. Pierre vini dit, c'est pas lui qui te promet ces bail ça. C'est Dr. Kenny Anthony qui te promet ça. Ngay mouto sa monsieur Philippe J. Pierre même dit à sous page 20 a manifesto 2021. Putting you first. C'est ça yo te dit. Mi sa yo promet à sous page 20. Universal healthcare will be implemented within the first term of a Labour Party government. So, Isam Labour Party commence le Philippe J. Pierre vini premier ministre. Bon. Si Moussa di nou universal healthcare difficile, yo poko sa di nou ki manye universal healthcare ka travay, et mwen tan yo vle kouye eleksyon mwa prochain. So, term yo ka fini, ek yo poko sa ban nou anye asu universal healthcare. Tan sa yo di anko, St. Jude Hospital will be reopened within the shortest possible time. So shortest possible time c'est pas 4 l'année. Because 4 l'année a passé et shortest possible time poko ive. OKEU Hospital will be adequately resourced with proper emergency services. Saint-Lucien, mande ko question. Ma même aller sous lettre là c'est Medical and Dental Association na voya. Le ou aller au KEU. Est-ce ou est ça c'est en l'hôpital? C'est pas c'est nos leg docteur qui problème là. Est-ce c'est nos ek docteur ni sa yo besoin pour occuper santé moun en l'hôpital là. Because tant sa yo promet we shall make the OKEU hospital will be adequately resourced. Ou sav sa adequately resourced mean? Pas just doctor ek nos. La si pose ni plasta, la si pose ni fil, la si pose ni toilet paper, la si pose ni WeMed, la si pose ni bon equipment qui ka travay, sou vle fan X-ray, sou vle fan MRI. Ki sa yo ja bay l'hôpital la pou y travay bien? Ça c'est question moi. Dans si les bas parti continue qu'à promettre l'année après l'année et que yo poko délivrer qui temps kay joindre. Tant ça yo dit in demonstration of a Labour Party's government commitment to healthcare and the well-being of its citizens, a percentage of GDP will be committed to the maintenance and implementation of St. Lucia's healthcare system. Yo di a percentage of GDP. Yo pate jamais di nou yo kay me a new health and security levy sous Saint-Lucien. Et qu'après yo me levy a, c'est pour payer en loan, c'est pas même pour garder about santé moun en Saint-Lucien. We are at a critical juncture in the health services. And as you heard from Mr. Benson Emil this morning, la ni débat qui ka trouvé koy présenter ba. Partisan flambeau ka présenté National Health Insurance. Gouvernement Labour ka promet universal healthcare. Et que yo ha promet ça pour 14 l'année et que yo poko ça présenter. Et content monsieur Emil dit même les bas parti a qui dou yo pas joindre rien à sous health insurance en Saint-Lucie ou changer pli bonnet en terme yo dit yo pas jamais joindre rien yo pas ouais flambeau pas faire pièce travail à sous ça. Mi jodi a monsieur Moussa en interview a été ni semaine passée. Qui ça il dit? Il dit well li kay ni pou d'accord that anti-travail te fait et il présentait différents bagailles qui te déjà fait. Moi vraiment de Labour Party. Est-ce yo qui dit ces consultants là pour pas ban nous plan that yo discussé pi nou. Monsieur Benson Hamilton meeting la. Ek ou sav kote mena chay USP by Monsieur Benson Hamilton. Pas di temps se nom lantan le screen nan ka présenter en bay ban nou. Monsieur Benson ouvert computer hier qui dit moi regarder ça nous ja fait pli travail parce que ça c'est consultant là ja fait. Plan flambeau déjà développé en ministre Health, en ministre Santé en Saint-Lucie. Le monsieur Emile c'était permanent secretary en ministre là. Déjà fait travail qui trop pli avancer. Parce que ces consultants là yo mené sort l'autre pays. Ou savez, là où arrivé en grade 4 et qui ont about travail grade 1, ces consultants là vini en grade 1 et monsieur Emile et Ministry of Health en grade 4. Ça c'est qui autant d'ouvant nous jaillit. So ça moi ka examiner là, moi ka ouais that c'est there Labour ka mene nous pour try kwenye moun set lisi. Jot mene rôle set moun, jot mene yo vini ek pa di tan mwen te ke ekwi notes mwen, yo di mwen pe ekwi rien. Nou kay voye présentation a bay tout moun ki a meeting la. Kome mwa hani office opposition a hakou laskouye pour rapport ça. Nous pou joindre ni. Mais moi ha di yo le moi assise dans place ek moi ka koute. Nga registre l'idée moi ça moi tan. Ek ça moi tan c'est yo ni pour joindre en manière pour payer pour lui. Ek yon se recommendation na yo ni pour payer pour lui. C'est pour mettre en taxe neuf à sous Jean Saint-Lici. Ek moi joine information moi from moun en gouvernement that Labour Party ka plan pour si yo gen élection pour mettre 3% à sous VAT encore. Another 3% on the 15.3% that is there to cover because you have 2.5 là. Now I do. Si yo hausse VAT là, Andy il a 12.5 et yo mene 3%, c'est 15.5. Et yo add 2 because yo ka check levy après yo calculate VAT là. So ka paye levy à sous VAT là. Ça kay monte pour presque 19% en VAT nous kay paye en Saint-Lici. So Labour Party nan plan ek yo poko di ki manière yo kay finance li. Mais moun ka mande nou ki manière gouvernement flambeau kay finance National Health Insurance. Now, on examine des proposals. Qui sa ki UHC, Universal Health Care? How is that supposed to work? Pour Universal Health Care travail, ça mean c'est gouvernement qui ni pour présenter tout service là moun kay besoin. C'est à l'hôpital et en health center. Now Moussa poko se explain sa ban nou because yo poko sav ki manière pour 17 lycéens qui sa yo nan plan et qui manière kay travail. Flamboyant opposition et nous sa ba pli idea qui manière National Health Insurance kay travail parce le Labour Party qui ka présenté en plan. Il y a 14 l'année. Yon idea en tête yo. Yo tan moun ka parle about universal healthcare. So yo adopté. Yo poko sa présenter un plan. Pas même abay ki ni yon page kon han ki ni information à suivre pour 17 lycéens. Moi j'arrive tout manifesto yo mwen tous les deux. Celle sa ka di nou. We will implement universal healthcare. Il poko di nou ki manière il travail. So, mande ko ça. Si whole Saint-Licien ka couvert par universal healthcare et tout malade ou ni, tout problème ou ni, c'est l'hôpital et be health center ou ni pour aller. Mande ko, si ba l'état ça en c'est l'hôpital la hordia. Et tout moun Saint-Lici qui malade. C'est pas tapion yo ka ale, c'est pas office docteur because universal healthcare c'est un government institution. Health center, polyclinique et l'hôpital. Mande ko. Est-ce ou d'accord pour continuer payer l'argent pour universal healthcare et ou pas pièce en koto wa yo docteur, qui laisse docteur wa yo et qui manye wa yo docteur. Now entend ça. C'est Labour Party qui nous vient expliquer ban nous qui manière universal healthcare kay travail. Et monsieur Emile bayanti information là qui bien important. Il dit nous tous les deux systèmes là kabati pour ba plus service en santé. Ou ni pour examiner qui laisse qui pli en bénéfice. Ça yo kouye universal healthcare, eh ben national health insurance. Qui mane yo kay finance ba ça? Tan sa di universal healthcare government funded model. Now ma deko, l'hôpital pas jamais ni sa besoin. Health center pas jamais ni sa besoin. Polyclinique pas jamais ni sa besoin. Tout docteur nos ka quitté kay l'autre pays, kay différents côtés ay travail. Gouvernement pas sa maintenir. Ou quoi, si ou pas sa maintenir, sa ou hani la, c'est plus ou ka preme à sous compte. So ou ka di mwen komwen ni health insurance mwen. Mwen still ni pou paye pour universal healthcare. Because si c'est qu'on me man pièce choice. Si ou just me a tax a sous tout moun a paye, so nga paye health insurance mwen. Ek mwen ni pou paye pour UHC encore. Même si ma a servi UHC. So ça c'est ces bail là, nous ni pour examiner en deux modèles là qui ka présenté. So tan sa dit state là kay ni pour payer, eh ben gouvernement kay ni pour payer pour tout service pour whole population. Ma d'accord ça. Si tout le monde qui malade, est-ce nous n'a c'est l'hôpital Saint-Lucie? Est-ce si ou pas même ni pour un office docteur, tout malade ou ni c'est l'hôpital ou pour aller dans health center. Combien de docteurs qui en c'est health center? Yon fois par semaine ou un docteur en c'est health center à dans ces côtés. So ou ni pour si ou malade et c'est mardi docteur à l'hôpital kay en health center et yo dou en pa ouest là ou ka wete à premier côté on pour aller sans health center. So sou tombe malade dimanche on pour espérer juste mardi pour aller en health center yo docteur. Ek un bas national health insurance la kay ni provision si l'on situation pour ça yo docteur privé ou pas signer ça. So en examinant l'autre ba yo dit encore un petit pays qu'on Saint-Lucie qu'on nous ka examiner gouvernement pas ça run whole système santé parce qu'elle a pas ni assez l'argent pour mettre en dedans qui autant taxe yo kay fait nous payer pour faire ça travail. So en garde yo dit UHC c'est pour moun qui ni 80 l'année ou pas payer rien. Le way l'hôpital là, yo dit ça pas ka apply en l'hôpital là, c'est un health center ça ka apply. Depuis temps moi levé Timamay Health Center toujours free of charge. Qui tant moun de ka payer pour aller docteur health center. So les moins dou en bas, ou ka prendre pour blague de là, ou ka quoi c'est blague en bas. So les moins dit si ou malade, ou n'bou espérer jouer docteur en health center. So moun nan ki ni 80 l'année, 80 years, yo di yo ka van ba universal healthcare. Mais le way l'hôpital là, yo dou sa pa ka apply pour l'hôpital là, sa ka apply pour health center because sou way l'hôpital là, sou tombe malade dimanche ek way l'hôpital là on pou payer. So pour pas payer, on pou espérer mardi le docteur health center. Si malade ou pas sa chebe pour juste mardi, ça ou kay fait. Saint-Lucien, an nou ouvert nous, et kan pas quitter moun kwene nous, à sous c'est l'histoire. Moun qui vle gen politique ka vin di nous. Le baka di nous l'histoire. Tan ça, il dit UHC kay met en chay pressure à sous l'argent gouvernement. Parce que gouvernement pas ça même bay OK you assez l'argent pour gain toilet paper et fil pour coup de moun faire l'opération et c'est bay ça. Si tout le monde ni pour aller là qui ça qui kay rive OK you. So an garder ça c'est bay là yo pour mettre là. Ek mwen met lat monsieur Emile bay information ça. Mwen dou ça c'est un homme qui copan département santé. Ça c'est un homme qui travaille en gouvernement pour un chailane. Ek même si ouais pas un homme qui fait désordre comme moi. Monsieur Emile c'est un homme that où ça dépend à soi. A man who is quiet in his ways. But when you give him a task to do, he gets it done. And I am amazed and I am pleased to see the amount of work Mr. Emile did as PS of Health. Ek mwen ka kwe that le flambeau gen eleksyon sa, nou kay nan bon nom ki kopan Département Santé pour aider nous implémenter National Health Insurance ça nous ka parler about là. Ça c'est un homme qui kay ça délivrer à tout ça. Because tant information ban nous. Il dit pour 4 années demi Labour là. The Labour Party has only been able to provide for 360. Ou savez yo di yo kay bay tout maman qui go boudin bagay free of charge. C'est health center. Pour 4 années demi, on y 361 moun qui a joint service ça en ces health center cette lycée. So quand moi 4 années on y 300 madame nous qui a go bout dans cette lycée. Et qui besoin aider en ces health center 361 361. Tan sa ou tan mwen te do yo me snake bite free of charge because you have ek merci bon Dieu c'est monsieur Emile qui lek mwen hodi ya. Mwen te di hod le hod me Prosper Minister of Agriculture et Forestry te whole Saint Lucie te kay vin la foui. Whole Saint Lucie te kay tourner forest. So yo te ha sav sa yo kay fe nou. Yo mette snake bite free of charge. So se yon se service la ou sa jwen free of charge. Now yo pa me bay kon bet anipi, ou sa van bet anipi mor de brek di jou, sa be bat sa yo doctor because he pa free of charge. So se parking pour mor de ou pour aywe doctor. Now dele se bay sa ka pa wet akodi se black gouvernement sa ka gouvernement liba sa ka bayek nou. Free snake bite. Pour 4 années demi, yo ha tou ete 4 moun en bas ça. Mais yo dou c'est ça, yo ka beau service yo ka bay free of charge. 4 moun. Et combien 1000 moun ka mort Saint Lucie, yo pas a joindre treatment. Yo di nom ki ni cancer pour venir screen. Pour 4 années demi, 1140 moun, 1140. C'est ça qui a joint screening. Et pour cervical cancer, 4780. 4780. Madame a joint koyo screen. Majorité population, 180 000 moun. Pas qu'à joindre pièce service free of charge from sa gouvernement ka offert là. Because si nous add 5, 6, 7, pas même 7000 moun. Moi vle di, avoué sympathie by famille en odsa pour monsieur a qui perd la vie là. Samedi or souhait, la te na fundraiser by kon cancer patient. Yo fait fundraiser bali pour try masser l'argent pour joindre treatment. Yo discharge li l'hôpital la li samedi et qui mort dimanche. Dimanche bon matin. Ça c'est situation santé en Sainte-Lucie. Moi tan la tenyon mon chi même manière qui passé. En bas Universal Healthcare Insurance la nou ka prezante kom partisan flambeau. Se moun sa kay jwen traitement yo a le insurance la kay paye pou li ek si la vi yo sa sauve i kay sauve. Yo pa kay ni pou espere pou fan fundraiser pou ende ko yo ek pou ende situation yo. So sa nou ka examine la. Na wan chay moun kadou côté monsieur Chasne kay prend l'argent pour payer quantité l'argent bay moun. Ba moi prend un petit temps pour expliquer vitement qui manière insurance ka travail. Health insurance pas différent pièce lot insurance. Moi ni health insurance, moi ça servi comme exemple. Moi ka payer moins qui $200 par mois parce que moi prend health insurance mwen longtemps avant mwen vini a bay politics. So plus jeune ou prend health insurance ou c'est plus bon, plus ou en bonne santé, c'est plus bas premium ou kaye. I ka couvert pour si mwen a 4, si mwen l'autre pays kan bay wive mwen, health insurance mwen ka couvert. Si mwen Saint-Lucie kan bay wive mwen, si mwen pou ay matnik, yo ka couvert adan. Even pour air ambulance la, si l'on sa ou paye, ka couvert pour adan se bay sa. Now, même si insurance la dépasse $100,000 sou mwen pour l'année a, sa pa min mwen pou paye insurance la $100,000. Même premium la nga paye, c'est ça nga paye. Si c'est $150 par mois, c'est $150 par mois nga paye, no matter qui autant l'argent insurance la dépenser à sou mwen. Là ou ni motokaw, ou sa gen un pick-up from Beachcomber pour $250,000, de là ou paye $5,000 pour insurance là, pour comprehensive, eh ben ou paye $10,000. Mais si machine ça a trouvé koy dommagé, ou ka jwen paye whole $250,000, eh ben whatever depreciation yo me asou. C'est qu'on insurance ka travail. Insurance pas différent. Ek mwen vle n'importe moun ki Saint-Lucie ki ni doubt about sa nou ka dia. Mande se police la qui ka jwen coverage pour $400,000 si yo mort par accident en le travail, si yo hen ko yo dommagé en le travail, yo ni health insurance yo. Mande yo combien l'argent yo ka paye. C'est pas $400,000 gouvernement ka paye ba yo, et c'est yo qui ka bay gouvernement l'argent pour payer ba yo. So manière yé assez ou ka paye ça nou kouyan premium. So là ou mande côté flambeau kay prend l'argent pour payer tout l'argent. L'argent partisan flambeau dit yo, les nous calculate, c'est à peu près $40 millions gouvernement kay ni pour payer bay c'est moun qui passe à afford pour payer insurance yo. Ek monsieur Emile parle about ça. Il dit pour ces moun qui pension, c'est moun qui pas travail, c'est maman qui ni chèque yo pas nan job. Ek il dit moun qui ka travail yo ek boss yo kay fait anti contribution towards qui manière yo kay paye pour insurance. Ek ça qui bon about insurance ça, c'est i kay aider ou. Parce que ou kay sa yo est docteur privé. Si ou ni un test pour y faire ek ou ala dans lab la ou pas obligé à l'hôpital la pour faire because insurance la kay paye pour ça en c'est différents private institution na qui kay part of National Health Insurance Plan na. So c'est pas tout ba ou kay ni c'est l'hôpital ou obligé à aller. Sou tombe malade ek ou passe ek c'est docteur privé ou pour y en c'était un monde visite docteur qui couvert en bas plan insurance ça là. Son Saint-Lucien examinez ça bien. Les bas parti kadou Universal Healthcare tout service ou besoin, c'est gouvernement qui kay ba ou. Et ou still ka paye pour lui. Because Kachile, yo met 2% et demi asu health and security. Yo kouye. Yo ka si l'on budget là, yo te supposé collecter 44 millions de dollars par l'année. Si on met l'autre 3% à sous ça qui a là, c'est en haut 60 millions de dollars. Les bakay faut payer pour still ni pour l'hôpital, health center, polyclinique ay docteur. Gouvernement flambeau kadou, gouvernement kay raise l'argent. Gouvernement même pour payer 40 millions de dollars bay ces moun qui passe afford et moun qui s'afford gouvernement kay fait yo c'est frustré employer kay paye un percentage of ça ou ka paye pour insurance. Gouvernement aussi dit nous kay continuer payer docteur, payer nurse, maintain l'hôpital là. So l'argent insurance là kay just pour run opération l'hôpital là pour make sure la ni we med la ni équipement la ni c'est bail là qui nécessaire pour ça joindre bon traitement pour santé. Examiner ça et balancer débat là qui présenté là. Saint Lucia, let us examine carefully 14 years of promises of universal health care, another term of Labour Party ending, and no implementation of universal health care in sight. A UWP government under Alan Chastanet with one single term in office had done all the groundwork to the point of even getting premiums from the insurance companies. Ek Monsieur Emile parle about ça. Moussavin di insurance di se $166 par mois pour moun. Comment c'est police la ka paye just 1,400 ke choy police. Pli ou ni moun ada insurance, pli premium la descend. So let nous te ka examiner ek mwen sav because mwen même parle ba ya dans ces insurance company. Nous te ka gade api pou 90 pour $100 par mois. Si c'est $100 par mois, il ka vini $1,200 pour l'année. So c'est pour ça nous savons si nous ni whole population en dedans. Nous sa négocier en primaire puis avec ces compagnies qui kay couvert pour ces moun sa ni health insurance. If there is one thing I want to see, I don't know for the rest of St. Lucia. And I know Emil and every candidate of the UWP will speak to their own people. But if there's one thing I want to see for the people of Castries Southeast, is that we can implement national health insurance, that every family in this country will be adequately covered, that families will not go into poverty, will not lose their entire life savings over an illness, because national health insurance will alleviate that problem for every family in this country. The only way that can be realized is when you vote for the United Workers' Party in this upcoming election. Whenever the Prime Minister has not indicated when he is calling the election, but we hope he calls it sooner rather than later. Because the sooner we get into government, the sooner national health insurance will be implemented. Just Kachilesa, Pas du temps nous kay travailler avec les autres moun. 40 000 moun pays qui passe fond là. Gouvernement ça implement insurance ça by ces moun ça right away. Except because moun qui sa afford peut-être kay hesitate yo kay di moi an insurance moi this moi that. But c'est moun qui passe fond là. Ça c'est moun nous plus concernés about. They come to us as candidates. They do fundraising activities. They try their best because when you have a loved one who is sick, you will do whatever you can. You will sell your vehicle, your house, your land, whatever you have to give that person a chance to survive. Our life is worth more than that. And I've said, if we can find money to spend on everything else, we can find money to cover the health cost of all our poor, vulnerable, and needy people in this country. And that is the commitment of a United Workers' Party. And I know with Mr. Benson Emil, and the work that he had done in the ministry, he knows this thing inside out. If the Labour Party really wanted to know what to do with healthcare, they didn't have to bring in a consultant from outside of St. Lucia and pay hundreds of thousands of dollars. They could have just called Mr. Emil and say, as former PS of the Ministry of Health, just do a presentation to the government of where you all were at with the implementation of national health insurance. And they would have gotten enough material. And by now, St. Lucians would not be struggling for health care. But you know what? This is not about us. Every minister of this government who has been sick is flown overseas, some at the expense of the taxpayers of this country. Those who do their follow-up visits, they do their follow-up visits overseas. And I know that for a fact. Some of them go as far as England, the US, Barbados, Trinidad, Martinique. While you are struggling to even get to see a doctor at the hospital or at the health center. A UWP government will fix healthcare once and for all in this country, and every St. Lucian will have access to the same quality of service regardless of your economic status. I thank you, and may God bless you.
Thank you very much, Mr. Guy Joseph, and you just heard him in both Creole and English elaborate even more on the health situation in this country. And of course, he also pointed you to some of the bluffs of the St. Lucia Labour Party, making promises that are not kept. And now that election is approaching, you're trying to cover their lies by coming to you with more lies. But I'm sure that if you're tuned in to the United Workers' Party, you are well acquainted, well aware with what the actual reality is. There is hope with the United Workers' Party, and of course, St. Lucians can rest assured knowing that, for example, with the National Health Insurance policy of the United Workers' Party, people dying for want of resources to take care of their health will be a thing of the past. People having to resort to charity when they are sick, many of whom die in the process of raising funds, will be a thing of the past. And not only will we have lives saved, we will have a healthier nation by virtue of the fact that healthcare will be accessible to all St. Lucians. I want, before I thank you, to ask that you join us on Tuesday for Meet the Opposition. On Thursday for Meet the Opposition on Rev Up from 9 o'clock in the morning. And of course, this Sunday we will be taking a break. We'll be having no Flambeau Live. This is a time for us as a nation to celebrate and enjoy our Journée Creole. But on Monday, we'll be back with Like It Is, and Tuesday, press briefing, Thursday, media opposition, and we'll have an event on the following Sunday for you. So stay tuned, remain tuned into the United Workers' Party as we provide you with what is happening in this country. We shed light on the truth, and we inform you on matters that are of interest and concern to you. I want to thank all of you who joined in this morning. I want to thank those of you in the diaspora. Like I say, you always religiously tune in, showing the level of concern and commitment that you have for your homeland, St. Lucia. I want to wish every one of you an enjoyable day. Thank you very much.